Mr. Speaker, for 20 years, successive Liberal and PC governments have talked about team-based multidisciplinary care here in New Brunswick, but have refused to fully fund this model. Once again, this government referred to the need to decrease the percentage of doctors working in a solo practice model in its throne speech without proposing a solution. We know that team-based healthcare, where nurse practitioners, dietitians, respiratory technicians, midwives, mental health care specialists, and other allied health professionals work with doctors, provides the best care for New Brunswickers. But despite proposals from the health authorities and asks of younger physicians, we have seen year after year of inaction from successive governments. Will the Minister of Health finally commit to providing the necessary funding to create team-based community health centres all around the province?
Thank you very much, Mr. Speaker. I appreciate the opportunity to once again talk about the commitments that we've made and the commitments we are fulfilling. In 2023, provincial budget committed to an additional $39.2 million to improve access to primary care. That includes $10.35 million for the transformation of primary care healthcare from solo practices to a team-based approach. There's the commitment, there's the money, Mr. Speaker, and we continue to do the work. You know, Mr. Speaker, we continue to recruit, to again have physicians, NPs, the proper allied healthcare professions to staff these facilities. And again, when you're working with those facilities, I suggested earlier that there was a number of successes. September, Horizon St. John Upper Healthcare Centre became offering same-day self-referral appointments. In August, Tuesday night, after-hours clinic established in Canterbury. Within the province, there's 55 of these.
The member for Memramcook-Tantramar.
Mr. Speaker, it's important to recognize that there are many communities and many doctors and nurse practitioners who want to practice in these clinics and don't have access to them. And it's an important tool in terms of recruitment and retention. One specific example of a proposal is in Sackville, where Horizon has opened a part-time clinic and wants to expand it to serve more people in our community. After 2 doctors left this summer, I worked with community leaders to urge Horizon to create a stopgap measure to ensure residents still had access to primary care until a permanent solution is found. The clinic opened in September. However, thousands of residents in Tantramar and Straight Shores still need primary care. We know we need team-based health care all across the province where nurse practitioners and other allied health professionals can work with doctors. What is being proposed in Sackville is what we need. Will the Minister of Health commit to providing the funding that Horizon will be requesting to expand the Tantramar Community Health Care Clinic?
Minister of Health.
Well, thank you very much, and I appreciate the member across the way is a strong advocate for her specific community. And I know I've been to Sackville many, many times. I graduated from Mount A, as did my daughter. So the fact of the matter is, Mr. Speaker, that Sackville is an important part of the healthcare network across the province of New Brunswick. And we were there and just did a ribbon cutting on the new emergency facilities down there. Again, making sure the investments are made within the community. And Mr. Speaker, we've talked about Beale University, which is also going to be locating and training and educating RNs within Sackville. So there's lots going on in Sackville that the member opposite just decides to ignore. And we've had commitments from the RHAs, we've had commitments from Margaret Melanson, who was down in Sackville, and we were in the atrium, a very nice place where people can go and convalesce and again take care of some of their needs with respect to mental health. And again, the investments are being made. When I look at Vitality,
Thank you, Minister. Chef de l'Opposition.